Well, hello. Thank you so much for joining us today at Chainwork TV. My name is Kori, and we have the lovely Dr. Arienne Wrigley is here to talk about women's health. So thank you so much for coming today. How are you doing?
Thank you for having me. I'm doing great. How are you?
Always fabulous. Thank you. So let's just get into it. I want to know and talk to you about what is physical therapy and how it relates to women's health.
So women's health in the PT realm is really about pelvic health. So if you have a pelvis, pelvic health pertains to you. So it could mean addressing low back, SI joint pain, hip pain, but it also could mean addressing things like pelvic organ prolapse, interstitial cystitis, decreased libido, painful sex, urinary and fecal incontinence, and then in the pregnant and postpartum population, it could be C-section scar adhesions, it could be diastasis recti, things like that.
I'm hearing a lot of good things. Yeah, our body goes through trauma. I'm hearing a lot about incontinence. That happens to a lot of us, huh?
Yes.
Especially women.
Yes, absolutely.
Did you know, and it's mind-boggling, that 25 million Americans suffer from incontinence, and about 75 to 80% of them are women. Why? Please tell me, why is this underaddressed or undervalued?
So I think it's a multifaceted question or answer. First and foremost, women in general, at some point in their lives, most women are going to bear children. And here in America, we really fall short in rehabilitative care for postpartum mothers. So in France and other European countries, women are getting PT visits as a standard of care in their postpartum period, whereas here in America, we get 1 6-week checkup, which is really just to ensure that everything is healed, to clear us for sex, to clear us for activities. And so there's no real discussion amongst physician and patient about preventative care, how or when to address pelvic floor concerns. And then on top of that, we have a society that really is kind of taboo about pelvic health. We don't talk about sex. We don't talk about our vaginas. We are scared to...
And we're lost. We're not informed.
Yeah, you're just scared to ask the question. And so for women, for a lot of women, it's invasive, it's personal. We, in some cases, may feel shameful about it.
Yeah.
And then if you do address it, you may feel dismissed. And then, of course, we've got moms and cousins and grandmas who are all telling us that our induction into motherhood is a lifetime full of incontinence.
Which is crazy,
yeah.
Right?
Yeah, as a 25 or 30 or 35-year-old mom, you don't want to know that you're going to pee on yourself every time that you jump.
So no more CrossFit.
For the rest of your life.
Yeah.
And that's the thing. Grandma wasn't going back to CrossFit. So the times have really changed over the last 30 to 50 years where women are really prioritizing their health and their fitness, and the healthcare system has really lagged behind in that. So we're kind of not up to par.
Yeah, so we go through a trauma, we go through incontinence, we're blown away, right? And then we get something called diastasis recti sometimes.
Yeah.
What is that for those who don't know?
So diastasis recti we see most commonly in the pregnant and postpartum population, and essentially it's a lengthening or a stretching of the connective tissue between the two recti muscles. So the linea alba stretches out as your uterus enlarges.
So we're big and we split.
Yeah, pretty much. And then in the postpartum period, it's oftentimes exacerbated with an early return to lifting, even if that's lifting the car seat or lifting your baby out of the crib. And so the best way to focus on healing diastasis recti is to address proper breathing techniques, proper and efficient posturing, and then really working on the pelvic floor and core muscles to reestablish that foundation, which will help regulate that intra-abdominal pressure.
Yeah, and as PTs, we tell each other, no crunching, no things. We help you do the right things to avoid making anything worse, right?
And it's not that crunching is bad, it's just that if you don't have the ability to regulate that intra-abdominal pressure, the chances of you doing a crunch and exacerbating that condition are much higher.
100%. So tell me some of the concerns that you hear from women with regards to their health? What are some frequently asked questions?
So amongst my postpartum population in particular, I frequently get the question, will I be able to X, Y, and Z? So return to CrossFit, do a plank, jump on the trampoline with my kids, to which I say yes. In most cases, it's possible to return to whatever it is that your desired goal is. But you need to establish the foundation first. So like you said, your body goes through trauma. And without rehabilitation, if you tear your ACL, you go to physical therapy.
100%.
Having a baby is traumatic, whether you have a vaginal birth or a C-section. So you just need to reestablish the foundational strength, the breathing, the coordination of those muscle groups, and then you build from there. The other really common question I get is about sex.
Yeah.
So will this help my sex life? Why does sex hurt? Are two of the common questions that I receive from my moms. And yes, an active and healthy and strong pelvic floor can enhance your orgasm.
Yes, we love that.
And who
we
doesn't
all
want that?
Ladies and men. Thank you.
And in the postpartum population, you see a lot of women with painful sex because hormonal changes, mental and emotional exhaustion, physical exhaustion, poor nutrition. And so reestablishing the core and pelvic floor is great, but also things like taking a brisk walk or getting in the pool and swimming. These are things that will help to not only boost your mental and emotional state, but your physical and sexual health.
Sounds like we're building some confidence, right?
Yeah, and I tell my women all the time, you taking the time to invest in that for yourself not just helps you, but also your partnerships. So
100%. And how else can physical therapy help with sex and libido?
So in general, if you think about physical therapy, we are focusing on movement to help our patients heal. So someone with low back pain comes in, the pain itself can affect your sex life, but also strength and endurance. So as we build strength and endurance, we're building confidence. We are improving body image. We are releasing endorphins, which is also going to then increase your libido. And in terms of something more specific to women's health, if I have a patient, let's say, that comes in with a prolapse, who also maybe has some concerns about her sex life, not only are we going to strengthen the pelvic floor to help support the muscles and the tissues and the organs that are within our pelvic basin, but helping her with proper positioning can relieve pressure on certain tissues, can help increase her comfort and give her greater pleasure. So we work on stuff like that too.
So movement, exercises, muscles, Kegels, reverse Kegels, right? Mm-hmm. What is that? And I've heard a lot of talk, and I feel like a lot of women actually don't even know how to perform a correct Kegel. Have you had a lot of experience with that?
Yes. So to start, a Kegel is a pelvic floor contraction. So it's what we feel when we orgasm. It's what we feel when we are stopping the flow of urine. It's what we feel when we're stopping gas from sneaking out, when you're on a hot date. And and so by doing Kegels, we're strengthening the pelvic floor. However, in some cases, Kegels are not appropriate to prescribe to a patient, because if I have a tight and overactive pelvic floor, if I'm having pain with sex, if I have vaginal or rectal pain, those are women that probably need to work on the reverse Kegel first. So relaxing the pelvic floor. And the way that I explain that to my patients is, if I have a really tight muscle like my bicep and I'm trying to strengthen my bicep from here to here, it's not very effective. No. So what I need to focus on first is getting that muscle to fully relax, and then you work on strengthening from there. A lot of women inhale on a Kegel.
Yeah.
And exhale and relax. And it's actually should be the opposite. So if you think of the abdominal cavity like a piston, and your diaphragm is the top and your pelvic floor is the bottom, as you inhale, your diaphragm comes down and descends, your pelvic floor should be relaxing. And then as you exhale, pelvic floor should be coming up, drawing in and up, and the diaphragm is returning, to under the ribs. And so by doing that, you're regulating the pressure. If I'm inhaling and Kegeling, I'm
creating more pressure.
which can cause diastasis recti, umbilical hernias, things like that.
And then we're lost again, and we're still there with no women's health, right?
Yeah, exactly.
Yes. Well, thank you so much for explaining, because I'm sure a lot of women were inhaling and lifting at the same time.
Yes.
So, sounds like PT, we're building confidence, we're making women stronger, helping with libido, helping release endorphins, right? Because as physical therapists, we work with muscles, right? We work with movement, posture, breathing.
And we forget that your pelvic floor is a group of muscle.
Yes, so that contracts and relaxes. So, when should an orthopedic patient visit you or any physical therapist?
So as far as orthopedic patients seeing someone who specializes in the women's health realm or pelvic floor, pelvic health PT, I tell my patients and the therapists that I work in conjunction with, if you have a patient who's coming to you with low back, SI joint, pelvic girdle, or hip pain, for instance, and you're having trouble seeing results with traditional measures, or if, for instance, you have a postpartum mom who's coming in, or even a pregnant mom who's coming in who has some of those underlying pelvic floor issues like incontinence, like a prolapse, or you notice that they might have a diastasis recti, evaluating the pelvic floor, sending them to a pelvic floor PT to evaluate the pelvic floor can be really beneficial in kind of bringing that plan of care full circle. So we just are able to evaluate those muscles a little bit deeper and then create a plan that is fully comprehensive.
I love it. Thank you so much. That's amazing. And I really do feel like women should reach out because it's imperative. It's underaddressed. It's an important topic. Nobody wants to be worrying about jumping on a trampoline or doing a lift and then bam, your leggings are ruined.
Right.
Right?
Yeah, we all want to be able to do what we want to do. And I think it's insane to think that in childbearing years, which, you know, in today's world is anywhere from 20 to 40, you have to worry about then spending the next 40 years of your life worrying about peeing on yourself every time you do something strenuous. That it's kind of preposterous. So, you know, I think it's really important to address it early and prevent those things from happening later in life. You enhance your sex life, you enhance your physical activity, you're stronger, you're more confident, 100%. And more mobile, for sure.
And that's important.
Yes, 100%.
Absolutely. So please let me know, where can we find you?
So I am Dr. Arienne on Instagram, and my website is drarienne.com. And I think that it will be in the show notes, maybe?
Yeah, absolutely.
So, yeah.
Alrighty. Thank you so much for joining us at Chainwork TV. Have a fabulous day.
Thank you for having me.
Oh, my pleasure.